In this video, the 1HP staff breaks down corpse husband's medical issues, conditions, and struggles.
Clearly. So the reason that we're making this video is to be really clear, not to give medical advice, not to critique any other medical providers, and not to say that we absolutely positively 100% know what's going on with somebody based on what they've talked about over the internet. That being said, when we read some of Corpse Husband's most recent tweets and watched some of his more recent videos, we definitely had some concerns about some of the interactions he'd had with medical providers. We've known in our own practice times that we've miscommunicated to our patients or things have been unclear. So we're mostly making this video because we want to try and demystify and clarify a little bit of what we think we're hearing here. And also because, I mean, anytime somebody tweets out something like, they basically told me I'm going to be in pain like this for the rest of my life and it's only going to get worse and there's not much I can do about it besides relieve it sometimes with injections. That's like a big red flag for us. There's really very few medical conditions that would cause you to need recurrent injections like that. And they're big and systemic. They're things like polymyositis, things like myasthenia gravis, big autoimmune conditions that have a lot more effects than just you've got some pain or difficulty moving. And so while we don't think that's what's going on based on everything that he's described online, we did want to dig into a little bit of what he has described, see if we can maybe interpret it a bit more clearly, and just help kind of make it a little more clear why somebody might be having pain for such a long period of time. And really to kind of give a little bit more hope that, it's you don't just have to be in pain, deal with it, and hope that injections are going to keep the pain at bay enough to function. Because like I said, it's very, very rare. There are very, very few conditions that would cause something that severe and that permanently damaging.
Exactly. So what I'm going to be doing is trying to provide an overall history based on what we were able to find online. And again, I want to start with the tweet that started us on this path to try to get and learn a lot more about what he was dealing with, what he's really perceiving through a lot of his physician visits and through a lot of maybe some of the test results or even interactions that he's had with some of the medical professionals. So to begin with, I'm just going to read out and there's going to be the overlay of his tweet. I did my needle EMG for my nerve conduction study and got some results that are not good. I don't really know how to process or cope with it. I still want to participate in everything coming up. If I seem off in any upcoming things, that is why. I don't really know what to do. And then he goes on to say, they probably identified the problems with my arms. They basically told me I'm going to be in pain like this for the rest of my life, and it's only going to get worse. So we already have some issues or some thoughts about that. But again, we're just going to highlight this history. And there's not much I can do about it besides relieve it, sometimes with injections. I don't know. So what we did was we really try to gather as much information as possible through what he had posted previously and through some streams that he did before, highlighting and trying to chronologically identify his interactions with medical professionals, what he was told, how he felt, some of the things that happened during that time. And what we found was, hey, maybe sometime in when he was 18 or 19, around 2017, 2018, he was diagnosed with fibromyalgia. And he has this really strong belief at the time that he had it. And this was described in his video. We're going to be highlighting it again in subsequent parts of this video. Some doctors were saying, hey, you don't have fibro. It's not possible. It's very common in women. And then he subsequently stated, hey, I did have it and they were wrong the whole time. And he was really highlighting how it's super complicated. So that was when he was 18 or 19. And just to highlight, he is, I think, 23 at this point in 2021. And then fast forward during this stream at 2019, he talks that he's in the past 6 months seen physicians 40 to 50 times and how it got very bad around October or September in 2018. And what he meant by very bad was he had these vision issues. He wasn't really able to see well. He started to get these brain zaps. And then he mentioned some things, what we call biopsychosocial issues, about how he lives alone, how he doesn't have much contact with a lot of people, and he stayed in his apartment for long periods of time, kind of ordering food to his house, and even stated that he was this anxious mess living alone at home. And I think afterwards, around the same time when it got worse in October 2018, he had a bunch of MRIs. He was cleared of a brain tumor, which means that he was told they're curious about a potential for a brain tumor. There's a lot of not issues, but sometimes if a patient is told that they're going to be tested for really severe issues, it could lead to some harmful thoughts that develop. So again, we're going to be touching on some of the underlying pain science and nocebo effects of why that's an issue later on, but he had some MRIs and blood work, and it seems that they weren't able to find much. And additionally, on top of that, he had some insurance issues, and with the
Never fun.
yeah, they're never fun. In America, insurance is a tricky thing, and often can lead to differences in quality and availability of care. So I think that's really important to highlight. And again, we fast forward even more to 2019. Again, he wanted to get back into videos. There were some biopsychosocial issues because he was scared of posting. He really felt this need to only post if he had things available for his audience. He woke up one day, and now we're able to kind of identify some physical symptoms that he felt. And he woke up saying that he lost feeling in his arm. And it started in his right wrist, and they didn't know what was wrong with him. Still he was sort of attached to this idea that he had fibromyalgia. And hold on real quick. Hold on. Just gonna close it.
Who'd your wife aggro?
Live.
Yep.
No, she's doing laundry, and my door was open, so I closed it. So it's okay. I can just transition this part. So he woke up one day and he lost feeling in his arms, and it started in his right wrist. And again, his physicians told him they didn't know what was wrong with him, and he was still sort of holding on to this belief that he had fibromyalgia. He couldn't click or type anymore. He was tested for rheumatoid arthritis, and it traveled up to his elbow. And no matter how many doctors he saw, they couldn't really figure out what was wrong with him. And at the same time, he also mentions he really wanted to power through and beat this, in the sense that he wanted to still create videos for his audience, which is, obviously it's great that he cares so much about his audience, but he decided to do everything with his left hand, right? So I think that's important to highlight. He also had x-rays, CAT scans, and he edited and did things with his one hand, his left hand, when it started on his right. And guess what? In March, he started to say that he woke up and his left arm started to lose feeling. And this was after he had posted in March, when he did everything with his left hand. And now he couldn't move both. He started to compensate, and he reminded his viewers that he's alone. He was left to his own thoughts. And then from there, he continued to see physicians that we feel may not have fully taken the time to understand his condition, because he was given a brace, or he was told that he was needing to have a brace for his neck, and due to insurance issues, he wasn't going to be able to get it for 3 weeks. He mentions there he has chronic insomnia, some sleep apnea, and also the symptom of arm inflammation if he texted anyone. And that's important to take note of. So he took a lot of medication. He was saying that. We don't know what medication he was taking. So that's going to be something we'll probably discuss later on. But something really important he mentioned in that section was he started to do nerve glides, and he started to stretch the nerves so that he could use them, because he felt that it was a nerve issue, even though a lot of the physicians that he was seeing said it was tendon related or tendonitis. And unfortunately, even at the same time, adding insult to injury, he had some news that his mother was dealing with a diagnosis of cancer. So there's a lot of these combined issues that really led to where he is now. Maybe again reviewing, getting to this point where he feels like he's gonna deal with pain for the rest of his life. And so that is hopefully the entire history of what we were able to find. And I know you guys also kind of looked into what he was dealing with. Was there anything that I maybe didn't touch on that you guys were able to find too?
I think you covered pretty much everything. I just want to reiterate that we're just taking information from what we've been able to gather that's in public domain. Obviously, we haven't done an exam with the corpse himself, and we're just going off what we know.
Yep. The goal of this is just to give a little more information, try and clarify a little bit of the medicalese, which we know can definitely be confusing, and identify, make it a little more clear that, especially when it comes to pain, it is almost never just the involved tissue that is the problem. There's always some amount of how your body processes that pain, outside factors like the amount of support that you have, outside factors like your ability to access healthcare at all, which is a pretty big issue here in the US. The consistency of care you get, the type of the care you get, and how all of that together can contribute to making what's not actually all of that serious or severe of actual physical damage much, much worse.
There's definitely a lot to unpack here, and a lot of what we said about how these different factors can contribute to the overall perception of the situation by the patient, I think, are here. We're checking a lot of the boxes between his fear and anxiety about the medical care that he's receiving, the miscommunications between him and multiple different doctors, what they're saying, how he kind of has taken things into his own hands, and the stress that's coming with him not seeing success with the treatments that he's doing, I think is really kind of a perfect storm in this situation to kind of lead to these thoughts and beliefs that are coming out in his social media presence.
Definitely.
Exactly.
Yeah, so we're not here to say, oh no, this person should have done this when they were managing corpse, because obviously we're only hearing what the corpse himself has felt. But listening to what he has expressed, there's lots of topics and ideas that we probably want to clarify, because corpse is very popular, and we don't want the general public to have the wrong ideas based on some of the things that he has said. And obviously Corpse doesn't mean it. He's just sharing what he's feeling and thinking.
Yeah. We're almost taking this as an opportunity just to educate the entire community about some of these issues.
So yes, we're going to keep talking about Corpse's case here, and it's going to reiterate, it is complex. There's actually a lot of biological things that could be happening, some psychological things that can be happening, and kind of some of the social aspects as well. So in other words, we call it the biopsychosocial. Love that word. So yeah, there's just so many things to talk about. We can talk about what conditions could be happening. Again, we haven't seen Corpse ourselves. There definitely is a lot of psychological aspects coming up, such as he was anxious, he was stressed, he couldn't sleep, and then the social stuff. Well, he was saying that he was living alone, so in terms of a support network, that's already a factor, but also the type of job he will do, and we know he's a streamer, etc. All those things will feed into any sort of medical or musculoskeletal case. So I guess we can start off tackling from one bit at a time, and I thought maybe we can start talking with you, Kate, about why maybe the language practitioners use is very important. So just to kind of quote Corpse here, he said that the practitioners basically said, quote, "We don't know why it is happening, as in what's the pains he's experiencing and his symptoms, so we're going to give you a brace." And I just can't believe to begin to think maybe what could be going through corpse's mind. So yeah, what do you think about that, Kate?
I think, and I'm gonna consider here too that what we're hearing from corpse is filtered through his perception of what is happening, which is why it's always really important as medical providers to make sure that not only are we communicating clearly, but then we're checking in with our patients to hear, what did you hear of what I said? Can you describe back to me what's going on? Which I think is a really key thing for any practitioner in any case to do. But kind of taking at face value what he put there, being told after dealing with pain for a really long period of time, well, we don't know why it's happening. Here, let's slap a brace on you. That's disheartening, and it's also kind of scary. It's like, well, if you don't know what it is, how can you possibly treat it to get better? There's also kind of like that added psychological effect of, let me strap you in either a rigid or even a soft neck brace, which tends to communicate this is a severe and serious injury, so serious that you can't move around at all. And even if that kind of very often is associated with a little bit of an outdated model of how we treat neck and back injuries, it still very much affects how you perceive your particular injury, your ability to control what's going on, and your likelihood of recovery from that injury, which, you haven't even been given an answer of what that injury is at that point. So it's really on us as medical providers to make sure that we're saying, rather than just saying something like, we don't know what this could possibly be, here's a brace, it's something more along the lines of, we've ruled out thing X, Y, and Z. We suspect it could also be things A, B, or C. To get 100% certain, we're going to talk to this person, that person, and the other person, or we're going to follow up with this specific type of examination or imaging. In the meantime, just because it'll give you a little temporary symptom-related pain relief, we're going to put a brace on. This doesn't mean that you can't move. It's just when you're sitting for a long period of time, or say you're riding in the car and it's kind of bumpy, this brace will give you a little extra support then, help keep the pain under control, but then the rest of the time we do want you moving around still. That communicates, the same message. We don't entirely know, and you need to wear a brace, but without kind of instilling this fear of movement or instilling this fear of, what could possibly be going wrong with me. So it's really incumbent on us as providers to make sure we're communicating in a clear and, non-scary, non-threatening way, recognizing that for us, a lot of the terms that we use are just the everyday words that we know in medicine. Like, for example, you breaking down the word biopsychosocial. For us, that's like, I know exactly what that word means. For our patient, they might have no idea. So making sure that we're translating things into terms that make sense for folks. And speaking of terms that might need translation, the kind of effect that we're describing here, which Kev can get a little more into as well, is what's called a nocebo effect. And Kevin, what's the nocebo effect, and how is it related to a placebo effect?
Yeah, I think the easiest way to describe this, placebo is basically the contextual factors or the things that surround the treatment that actually improve somebody. So I think the most classical way is when we test drugs like medication, we have the active ingredient and the drug that has actually nothing really in it, and we sometimes find that even that drug with nothing in it actually has an effect, and it could be as simple as a patient believing that it's going to make them better, so then something psychological or even biological as consequence happens because of that. So the nocebo, with the big no for negative, is actually the opposite, where unfortunately maybe depending on the context, maybe what's been heard or understood, we get the opposite effect where the treatment is not as effective, or even if there's no treatment, the condition is worse. So a perfect example would be this, where if I was given a neck brace and that was it, and I wasn't really told anything else, and that's my understanding, my mind, I'm guessing, would be flying around, well, do the doctors think my neck has an issue? Or why does my neck need a brace? Is it going to collapse? Is it broken? Is it going to fall apart? If these things aren't explained, then I believe I would go into a state of worry and not want to move my neck, which is the opposite of what practitioners should be doing to encourage patients to get better with neck pain, which is basically to have movement, as long as it's not a serious problem like a fracture. So that's really the whole idea of a nocebo. So really thinking about what practitioners are saying. So your words are important. And also part of this can also be the rapport or the trust that a patient has with a practitioner. So you might be saying the right things, but if your patient just thinks you're an idiot, so to speak, then that will actually even affect all the advice and all the treatment you're giving. So despite having treatments that we research whether or not they work or not, how it's delivered is actually very, very important. And yeah, I think coming towards more to Corpse again. So, he's from America, I think from LA. Are there any particular things you notice in the US medical system that might have led to these things happening more commonly since you are in the country, Kate?
So, yes, as you might have heard from my accent, I'm our native US resident and Kev is from abroad. So I'm pretty darn familiar with the US healthcare system and the US insurance system. And I think really the best way to describe those two systems together would be stressful as hell. Which is to say, the way that US healthcare works, for those who are not from the US, you have a number of providers. Your providers may be in or out of network with your insurance company. If they are in network, your insurance company covers a certain amount of dollars per visit. If they are out of network, your insurance company covers a lot less or may cover nothing at all from those visits. So if, for example, the specialist for your condition is not considered in network with your insurance, the amount you'll have to pay to see them will be a significant amount more. There are certain appeals processes you can do to get someone considered in network, even if they are out of network, but it takes a while and most laymen don't know them. On top of that, one of the largest causes of debt and bankruptcy in the US is medical debt, which should tell you about how much money we spend on healthcare per year. Whether or not that's actually providing a benefit, like a significant value for the money that you've spent, is a bit of a gamble. And a lot of people will wait until a condition becomes really serious before seeking medical attention, in part because they're not sure how much it's going to cost them at any given time. You don't get a cost estimate in advance, you just get a bill. All of which is to say, the financial aspect alone of receiving healthcare in the United States is pretty darn stressful. You don't always know how much a thing is going to cost. You can't necessarily budget for what the thing is going to cost. And you'll kind of just get hit with a bill a good deal of the times. That amount of stress, psychologically speaking, can very much affect your perception of pain. This is one of those, yes, it's also in your head, and that's not to say it's only in your head, but what's going on in your head is very much affecting how your body is perceiving everything else, because that's how your nervous system works. Your nervous system spreads from your brain throughout the rest of your body. So if there's something going on in your brain, like say a heightened state of anxiety, which changes the hormones and neurotransmitters you release, the way your body processes pain is going to be different. Your threshold might be lower. Your senses might be heightened. You might be kind of more sensitive to a noxious or painful stimuli because your body is braced and ready for something to attack, because that's what we think of when we think anxiety. I need to be braced for something. Even outside of the financial aspect of things, there's also the fact that even if they're in network with your insurance company, that doesn't necessarily mean that they are all well connected with each other. So for example, if you have a condition of chronic pain and you're trying to figure out what's going on, you might see your primary care doctor first, who might refer you to a specialist like an orthopedist. If it's musculoskeletal in nature, your orthopedist might have an answer, but if it's not musculoskeletal, they might send you on to, say, a rheumatologist. And if the rheumatologist doesn't find anything going on with you, they might send you along to a neurologist. And ideally, all of those practitioners are working together, sharing notes, sharing information, so that you're not having to do redundant testing or repeating your story over and over and over again, kind of reinforcing those patterns in your mind each time you repeat it of just how bad it is. But more often than not, those providers aren't necessarily within kind of the same clinic space, so they don't necessarily have the easiest time communicating that to each other. So you end up with kind of this disparate network of professionals who aren't necessarily able to readily share information about your case. And that can mean things slip through the cracks. And in fact, it often does mean things slip through the cracks. Add to that the fact that these providers may or may not be in network. You might be able to afford to see one of them, but you certainly can't see the second one until next year when you got a little bit more money saved up. And then by that time, your condition may have advanced and changed, and they might need to send you for imaging all over again. You can see how somebody dealing with a chronic pain condition in the US might really struggle to get a clear diagnosis in a ready frame of time, not even addressing the fact that, pain science research really shows just how difficult it is for chronic pain patients to get taken seriously and to get their diagnoses in a reasonable and timely fashion, let alone getting those addressed. Which is to say, in Corpse's case specifically, since that's who we're discussing here right now, it's very easy to see how his chronic pain condition could have some psychological components that are exacerbated by the US medical system. And when I say it could have some psychological components, I am not saying that this is psychosomatic pain only, that it's all in his head and it's just presenting in his body from something going on in his head. I'm saying that using that biopsychosocial model, we're addressing the biological causes of pain, the way that psychological sources kind of affect that processing of pain, and how social constructs also support or worsen that perception of pain. And as well, that the US medical system is kind of, I don't want to say that we're uniquely terrible, because I'm fairly certain this is an issue for chronic pain patients worldwide. But there are definitely ways in which someone's information could slip through the cracks and slow the rate with which they could receive reasonable answers. And when you're waiting to receive reasonable answers, you're just building that stress, right? It's well, if no one can give me an answer, it must be even worse than something they see on a regular basis, or they know what it is, which kind of reemphasizes the same issue that we had with, just putting a brace on it. Regardless of how accurate it is or isn't to apply a brace, regardless of how accurate it is or isn't to say, I don't know, what the patient is hearing, what the patient is understanding is, this is so bad that nobody knows what to do about it. And that absolutely hinders recovery, and it hinders their ability to listen to someone who's telling them something other than, this is terrible and awful and going to ruin your life.
Yeah, no, you highlighted so many things. I think, the key thing with any kind of chronic pain condition is, the sooner it gets managed, obviously the better. And as time goes on, the body gets more sensitized, or like you said, the threshold goes lower, and then the pain, which is real, but it gets easily more triggered. And you just highlighted like an extra layer of the social aspect, in the US medical system. Because, for example, I'm, down under Australia, we do have, public free healthcare, so that changes a lot of the things you discussed, where if people do have a problem, they don't have to go, but how much is this going to cost me, to limit them to go. And there's just many different things that you can see how the psycho and the social part can really affect the bio. And to be honest, for most conditions, the bio is usually the easiest part. The psycho and the social part is the hardest part to kind of manage, and you can see the effects of it exactly in what we're hearing from Corpse here. So, I mean, we do want to actually talk about the bio too. So,
yes, with
all this in mind. And that leads us to the next thing, and the last thing for this segment is, I believe Corpse would say that, with all this happening, with not really knowing answers, he must be, worried sick out of his mind. At the age of 19, he was, thinking that, okay, maybe I have fibromyalgia. And I guess we should clarify, what is fibromyalgia? How is it diagnosed? What exactly is it, Kate?
So fibromyalgia is generally considered a diagnosis of exclusion. And what I mean by that is, it's not a thing that you can test for with a blood test or with imaging. It's not going to show up on imaging. There are some symptoms that go along with it that might show up on imaging or might show up on a blood test, but they're not like clear-cut, unlike, say, Lyme disease, where, you get tested, they detect the presence of, the certain serum and antigen in your blood, and they can say, definitely you 100% have Lyme disease, let's treat that. It's not quite the same with fibro. And fibromyalgia it refers to myalgia, pain of the muscles, and throughout kind of the fibrous connections throughout your body. Because those regions are innervated, they get nerve supply, and so they can feel pain. The diagnosis used to require having certain tender or trigger points. I think it was 7 or 9 out of 18 specific points on the body. If you had pain in those exact spots and somebody poked it real hard, that was considered part of the necessary criteria for a diagnosis. That's no longer part of the diagnostic criteria, because practitioners recognize that your pain can be kind of in different spots from day to day, depending on what you've been doing most recently. But generally speaking, fibromyalgia is a chronic pain condition that is also associated with chronic fatigue. Those two things usually go together. It's definitely something I've treated patients for in the past. I have a number of patients who have it. I have a number of friends who have it. But it's also a diagnosis that a lot of times, I don't want to say a lot of times, that's incorrect. It's also a diagnosis that absolutely has been given out when a person has a chronic pain condition. Doctors can't put a clear finger on what the thing is exactly, and they say, well, until we figure out something more better and more accurate to describe it, we're going to call it fibromyalgia. So the upside of giving it a name, giving it a label, is a person feels, they've identified a thing. Thank goodness. If we know what the thing is, we can treat the thing in some capacity. And it's really good to have an answer. That absolutely goes into the psycho part of biopsychosocial model. On the other hand, though, it does also limit your ability to consider, is it fibro, or have we just not landed on something that more accurately describes it yet? So your mind might not be as open to what if there's an Occam's razor explanation of, I have chronic fatigue due to, say, depression or anxiety, and I have this pain due to a specific musculoskeletal condition, as opposed to both of them coming from the fibromyalgia. It's also fairly tough to get a really well-rounded plan of care for fibromyalgia, in part because it's a little bit vaguely and nebulously defined, and in part because there is definitely there is concern in the United States about our opioid epidemic, and there is concern for providing pain interventions to patients that involve medication specifically. But there's also a limited number of practitioners who have a really good and solid understanding of chronic pain. And that's not just in the US, that's worldwide, which limits kind of how well that plan of care can be designed and then implemented. So my concern with somebody being given a diagnosis of fibromyalgia isn't so much that isn't the whether or not they do or don't have fibromyalgia. It's kind of the resignation that corpse seems to present is going along with that, which is just, I have fibromyalgia, it's always going to hurt, and it's always going to get worse, the end. Because one, if it is fibromyalgia, that's not necessarily true. There's definitely going to be some work involved to find a good provider to care for it, but that doesn't mean that, your life is ruined and you're only going to be able to play for 2 more years before your hands give out. And two, given what we know about information falling through the cracks in the U.S. medical system, the kind of desperation that you get when you've been searching for an answer for a really long time, and the relief you get from finding an answer, even if it's not the answer. And three, some of the symptoms he's described, I've got a bit of concern as to whether that fibromyalgia diagnosis is the most accurate one. And again, I haven't treated him, I haven't evaluated him, I can't tell you he does or doesn't have fibromyalgia, but based on some of the things he has described, I really do wonder if he might have kind of some more straightforward musculoskeletal conditions, which I think Matt and Elliot are going to be getting into as well, but I know we'd kind of considered, is there some element of thoracic outlet syndrome going on? Is there some element of, does he have some trigger points that he's dealing with on top of that? And then on top of all of that, how are the psycho and the social parts of what's going on contributing to the overall pain processing that he's dealing with? And Kev, you'd actually said something that I wanted to touch on a bit in that regard with pain processing. You talked a little bit about how stress and anxiety can play a role there. I know your research as well was in how limited sleep affects your perception and processing of pain. Can you tell us a little more about that?
In fact, the sleep pain research first started with conditions like cancer and certain groups of people with fibromyalgia where things weren't working. And obviously, as a practitioner, we want to find something that actually helps them. We're not just going to give up. So a lot of research has found that yes, a lot of these people with chronic pain often develop insomnia symptoms, if not insomnia itself. And actually, you can still improve insomnia through a variety of ways, and when you do, it actually improves the pain. It doesn't completely go, oh, the pain's completely gone, but we do notice that sleep tends to modulate or makes the pain experience worse, and so if you can fix the sleep or improve the sleep at least, it will make the pain better. So the theory behind that is some things like we said earlier on, where the body gets really sensitized, and that's usually a chemical component to it, and we know that sleep kind of regulates the inflammatory chemicals in your body as well, and there's a few other pathways which becomes very nerdy, but the simple thing is that sleep is problems are very common in chronic pain, and it's definitely something that's overlooked and should be managed holistically instead of just the pain side itself. And I think just looking at this case to bring it all together is, if I've had corpse in front of me, like I said in the very beginning, this is a complex case, and I'm not a chronic pain specialist. I'm a physiotherapist, but I don't work in a chronic pain specialist clinic, which do exist, which often have the teams that we were dreaming to have before. Like you have your specialist, a medical doctor that's in chronic pain physician is what we call it down here, and then you have physios specialized in chronic pain, and you have all these psychologists as well, and they all kind of work in the same clinic. So that kind of stops all the misinformation, or maybe not stop completely, but reduces it a great deal. And one learning point from this is, yes, if say you're in a system where people are everywhere else, as soon as I get a report saying so and so's come in and the doctors refer because of diagnosis X, this is a perfect example going, well, unless it's quite obvious that it is that diagnosis X, is always just reevaluate the patient, because this is the first time you've seen them, to kind of go, well, is it really that diagnosis, or is there something that might have been missed along the lines? And if a patient kind of goes from practitioner A, B, C, D, and they all kind of just look at the paper, or just go with what's said, oh yes, I was told I had this, or I think it's this, and they don't kind of explore that, then I think this is where problems like these can occur, where maybe it isn't that actual diagnosis. In this case, it maybe might not be fibromyalgia, it could be something else. And just to be a little bit of a teaser, the next video with Matt, Elliot, and John will kind of explain what else could it be, and does the patterns of what corpses describe match maybe something else that might be worth considering. So yeah, it's so many things to talk about this, and I guess the last thing is, the reason why we want to talk about all these things is we know corpse is very popular, and the thoughts that he says is obviously genuine. That's what he's experienced and feels, and he's got a huge listener base or a watcher base. He's a streamer, and I can't begin to imagine maybe there's a group of people who've have listened to what has happened to corpse and then had these ideas that won't be helpful if they do ever run into any sort of pain themselves. So this is why we are so passionate about making this video here, to try and not exactly go, this is what corpse has, etc., but bring out the ideas about the themes that have occurred during his discussions about his journey, and kind of teasing out the things about it which could be correct or not so correct. The other way of just explaining this simply is Dr. Google. So a lot of patients that come to us, they've got given a diagnosis, they Googled it, and sometimes those websites are complete rubbish and have made this person go, oh, I just need surgery. Like, there's nothing's going to help me. I'm going to come here for some sort of exercise because I was told to, but I just see on this website, you need to do surgery or blah, 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 blah. So that's just the big problem that we deal with every day. And it's
Yeah, absolutely. And we wanted to make this, again, not because we're trying to diagnose corpse from afar, because obviously we can't do that and we wouldn't even try, but more to make sure that it's really clear what some of the other factors that go into someone receiving a diagnosis when they've got chronic pain are, what kind of things can complicate and confound a case of chronic pain of some sort. And to make it really clear that having pain doesn't mean the end of your ability to game or to compete or to stream, but that a lot of times it's just a lack of understanding by some of the healthcare providers you might see who just don't have as much familiarity. And so it's good to absolutely have networks of people you trust. It's good to have healthcare providers that you trust, and really the folks that I'm most inclined to listen to as a professional when I go see someone as a healthcare professional are the folks who admit the limits of their knowledge, who recognize, when they can't give more answers, and know when to refer to someone else. Because it's really important that for our patients, we're providing them with the best care. And that doesn't just mean the best of our care. It means the best of our care and the network of practitioners that we work with and trust and respect. So I really want to make sure that we're making it clear to Corpse and Corpse's community that, again, we're not trying to diagnose this obviously complex and complicated case, but that we're trying to just provide a bit more information from the medical side of things about how some of the medical system stuff works, and to provide to our fellow medical practitioners a reminder and a reinforcement of just why it's so important, what language we choose, what courses of action we choose, and then how we explain those courses of action to our patients. And so hopefully with the upcoming video where we talk a little bit about some of the musculoskeletal things, the bio side that could be contributing to what's going on for Corpse, we're making it clear that hey, if you're having this kind of pain, you don't necessarily need to consign yourself to I can't ever play again. There might be some readily addressable things that you can get started on as of right now.
So and one last bit before we go to the bio, and it just came up to mind now. This is one last social point. If you do have pain, think of this, but also if you know someone else that has pain, think of this as well, where we heard from Corpse that he was living alone. So imagine having to try and kind of do what you need to do every day while having some sort of limitation. So your right arm was too painful to move and you're resorting to using your left. So again, what could have been better, and again, it depends on everyone's scenario. Sometimes it's really hard to have a nice social network, and sometimes it's there but maybe people don't know, is that yes, if people are struggling with doing one thing, then that's where the help of others is really, really beneficial. So let's just say, for example, Corpse has to do not just streaming, but all these daily things like cooking, cleaning, all these things. If there was even a helping friend there that was living with him, that could at least take the sting out of his situation. And for example, so you out there, if you have a friend that's in chronic pain, besides just kind of going, what's the diagnosis and getting them to the doctors, you play a big role in trying to help this person continue to kind of get through. And as the doctors and everyone else is trying to sort out the medical side, the bio side, at least you're helping this person, continue to live and have high quality of life, and that actually feeds back into how well they recover as well. So I think I could have emphasized that a little bit more punchially, but basically look out for each other. The social aspect is very important, not just the individual in terms of how much they earn or what their work is, or whether or not they live alone, but really it's the network they live in. Do they have help from others, family, friends, etc.? So yeah, I'll leave it with that.
We really appreciate all y'all tuning in for this, and we'll be passing it off to Matt and Elliot next.